right, hello, welcome back to Conversations with Dr. C. Today we have our guest Jason. Him and I, again, were kind of hooked up through a LinkedIn conversation. Got to having a conversation with him. I think he was driving down the road at some point, and I was kind of getting some other information from him. And I just absolutely loved his energy about being patient care centered. He's a lot of fun to talk to, and so we really look forward to welcoming him here today. And what we're going to talk about today is being more than a paycheck tech. So as you know, my name is Dr. Mary Cowan, and we're going to discuss some patient care centered ideas today. So Jason, give us an introduction and kind of a little background on yourself so this audience knows all your credibility.
All right, my name is Jason Lemke. I currently am operations manager for Advanced Imaging Management out of Houston, Texas. I started in my hometown going to X-ray school in '96, graduated valedictorian, went on to UT where I worked 16 nights on the weekend to get through college. Then I went from there, I came home, started a family, went mobile in 2001, and I've been mobile associated ever since.
That's great. All right. So a couple of things we're going to look about today. So some formalities, our objectives today. So I am a trained educator by heart. So I feel like I have to have learning objectives. I just have to do it. So what we're going to look at to explore some techniques to promote that patient care. We're going to expand a knowledge base dealing with patient engagement. I mean, you have to engage with the patient. You have to know how to do that. We're going to look at strategies to help create a more patient-centered care approach. And then we're going to understand and foresee possible obstacles that we could come into while communicating with this patient. So first of all, I like to do my canter in the beginning. I love to get to know people and more about them. So I always ask people, what did you want to be when you grew up? Like, I doubt very few of us were like, I would like to be, a radiologic technologist. Some of us are, but so what were you thinking growing up?
Growing up, I grew up on my family's ranch down in South Texas. So it was, I wanted to be something. I always loved the space industry. I wanted to be aerospace to start. And then as I started looking into that, I thought, well, I'll go marine biology and I can fish for a living. And my dad said, well, get a degree and then you can go live under a bridge. You'll be fine.
I don't think it's a bad idea to want to fish for a living, though. I could probably get into that.
But no, through life circumstances, I ended up needing to go through junior college and sort of pay a lot of my own way. And I applied to several different technical licensure and radiology. I thought, well, this one looks fun. I think I can do this one. And I got in and went to a wonderful hospital-based program at Citizens Medical Center here in Victoria, and just enjoyed it and went from there.
That's great. I love to hear good stories about education and how I had a really great program. You usually hear the flip side of those stories, like, oh, I had a really bad. So thank you from all us educators out there. We thank you for sharing a positive light at that.
I'll say, Johnny Griffin, if you're watching this or you see it, thank you very much, ma'am.
We'll hashtag it, hashtag Johnny Griffin. I feel like that's a suitable hashtag. So
yes.
How about, what was your first job like? How did you get it? How did you, once you did all this trained education, what was it like out the door for you?
I graduated on Thursday. I took the registry on Saturday, and I started my new job Monday morning in Austin. And it was different. I worked at South Austin Hospital. I hired there, great group of people, really enjoyed it. I learned how a big city hospital operated versus Citizens is a large hospital for our area, but you get into the large Austin-based hospitals, it's different. And I saw a lot of things that we didn't normally see out in a more rural setting. It was a great education.
That's great. I love that. I love the transition though. Like, you need different experiences for everything. So that's great. How about your first boss? What were they like? What did you learn from them? What did you take with you from that experience?
I took with me, find good people, put good people in charge, and let them do it.
Okay.
If you're going to be the boss, be a broad stroke boss. Don't micromanage your people to death.
Okay.
Let them take care of it.
All right. Yeah. We call it the honey pot mentality. Like you got to have your paw in like every little honey pot, that's a lot to get sticky in is what I think is what I
Yes,
always say.
it
So
is.
I can appreciate that experience very much. How about the progression of your promotions or your career changes? You started off as, like boom, graduating X-ray school, like 48 hours later, you're hitting the ground running. How did you end up where you are today? What's your path look like?
My
No
path
worries.
was rather circuitous in that most of my jobs came from contacts I made. When I left
Okay.
South Austin, it was because another technologist said, "Hey, Heart Hospital just opened and they need a night tech." Great. So I called up. He said, "Yeah, great. Come fill out the application. You're done." I worked at Heart. When I had to come back home, I called up the director of the program. She said, "Come on home." I worked for I got a weekend job doing MRI for a mobile service. I said, "I need something full time." He said, "Great, come on board. Why don't we meet each other finally?" And I did that for 18 years, got up to
Oh my
imaging
gosh.
specialist. And so when I got downsized in 2018, it was really difficult for me to actually have to interview because I had never done that. It was come in, fill the app, you've got the job.
Yeah.
And actually this job, I called up my old boss, and the first thing he said was, "Tell me you're coming back." I was like, "Awesome." And so, I worked for one of the most amazing bosses in the world. Um,
Oh, I
and
love that.
he's a good man. He's got great integrity. His ethos of how medical business should work just warms your heart.
Oh,
And so yeah, it's about service, and that's what he promotes. It's really awesome. So I've never found I couldn't think of a better place to be.
I love that. Well, talking about that service, let's kick off with some of our. So the first thing is we talk about how about communicating verbally with patients, just through just a basic introduction to like you had a great analogy. You were kind of like when we spoke, you were kind of walking me through what you feel that experience should look like. So help walk us through, what should that experience look like when we make that first impression on our patients from a verbal perspective?
From a verbal perspective, first, I'd say leave everything else at the door behind you. You need to be in the right frame of mind. You need to be happy and engaging. Your patient, you don't know what well, you've got a diagnosis, but you don't know how their life is affected by that. And so you need to be smiling. You need to take your time. If they're going to require extra time, you need to have it. I think we've gone very quickly to money, 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 money. Get them in, get them out, get them done, and that's not a patient relationship. So when you meet your patient for the first time, slow down a second. "Hi, how are you?" Don't just come on, let's go and walk off and expect them to follow you. Walk beside them. Talk to them, even if it's for a minute from the waiting room to the X-ray room. Take those seconds to introduce. Naturally, of course, we introduce ourselves,
Right.
but
Mm-hmm.
how you introduce yourself of, "I'm Gary," that doesn't work. It's, "Hi, my name is Jason. I'll be your tech today. You know, Come on with me. Let's get this done. It'll only take a few minutes." Or MRI, "It's going to take a little while, but we'll get you through it. It's not a problem." And you want to
Okay.
be reassuring right off the bat.
Um, okay, so I like your idea about you have to be in the right frame of mind. But do you have advice from someone who is not in the right frame of mind? Because I'll be honest, like there's days that I'm crabby. Um, there's people that can back that up. They're probably watching too. But so what happens if if you're like you have that heart of service, but your mindset just isn't there? Do you have advice for someone who's not in that frame of mind to communicate effectively?
Take Before you open the door to the waiting room, before you go around that corner, however you're set up, take 5 seconds, take a couple of slow breaths, and remind yourself why you do this job.
Okay, I could probably get into that. I just sometimes I love your thought about being slowed down because I think I like our exchanges are extremely conditioned. Like I find myself asking someone, like someone will ask me, "How are you?" And I'll say, "Good, how are you?" But I have "Good, how are you" out before they're done talking to me.
Right. Right.
So I like your aspect of slowing that down, and being a little more authentic in that delivery, maybe. Is that?
Always. Yeah.
Yeah.
No, you're absolutely right. And on that, when someone is talking, remember, don't start thinking of your response first. Listen to their entire conversation. Then, if you have to take a few seconds to process it and respond, at least you're being thoughtful about it.
I know. I always just feel so uncomfortable in those moments where I want them to know I'm sincere about processing what they have to say, but I feel like just as a society, we're very uncomfortable with silence. And so yeah, I'm uncomfortable.
Yeah, most people are. Most people can't sit in silence. I got trained from an early age, growing up out in the woods, that silence is okay. Silence is a good thing. For whatever, however you go, it's, the words are be still. So we have to learn to accept that. That there may be a moment of silence there. Let things just kind of go as they will go, and those moments also give you a chance to pick up all the nonverbal communication that your patient is giving you.
Do you think it's okay if can I preface something saying like, "Oh, I'm sorry, I'm just processing what you were saying." Um,
Mhm.
do you think it's okay? I mean, does that feel awkward to you or not really? Is that an okay tool or resource to use?
Not necessarily. Just you can tell people, give me just a second to think about that. Never be
Okay, I
ashamed
like
to
that.
say I'm thinking about it. That shows that you're at least taking it under advisement and
Yeah,
processing.
I like that. I'm gonna steal that. Give me a second to think about that. That's what I was looking for. And sometimes, like I said, I get very generic. I always laugh because I always tell the people at the airport when they tell me to have a nice flight and they're working security, and I'm always like, "You
You too.
too." I'm like, "Oh, you're not going anywhere." Sorry, my bad. You're here. Ha! I'm going on vacation. So anyway, so I like that slow down frame of mind in terms of that. How about if we take that another level, into like patient charts or narrative notes? I know there's a big influence and push in our profession that we kind of have to be the eyes and ears. So what about that written, like kind of flip side of that in terms of that basic history, what we're going to deliver beyond that general description?
Well, just remember that when you're typing it in, it's the same thing. A generic response for every patient isn't going to work because every patient isn't the same. So take a moment. Think about how you want to compose the wording that is going to the physician, especially to your radiologist. Let them know. Take a moment and think about, okay, how do I put this together?
Okay. I like that. It's just so it's about slowing down, taking your time. How about if we take this another step forward into the workplace with communicating with team members, with especially, let's talk about team members first, and then I want to shift to being a lead communicator because you seem like you would be a lead communicator to me. So let's start with the bottom here of just communicating to a team member. What's your advice on that? On communicating with that person you're spending like day to day with?
Um, well, obviously, you're spending day to day. You're going to get to know people. You're going to get to know personalities. Uh, I was really fortunate. I had a coworker that we spent 2 days a week, 10 hours a day in a mobile MRI trailer. My
Ooh,
wife ended up calling her my therapist. So
can I get
you
one of
get,
those? Wait, get one of those.
if you can find another Lillian, good luck. She was
Oh,
unbelievable. We still talk. She's still a dear friend, even though she's retired. It's you get to know the person and you become a little not friends, but you're friendly with them. You develop that rapport, and
okay.
effective communication with anyone is, if you don't know, don't be afraid to say, as like joint commission, don't say or make it up. Say I don't know, but I'll find out.
Okay.
Be willing to admit that. If
Um, how about if you have to work to build that rapport? Like if we're not all lucky enough to have the Lillians of the world, I mean, I know we're not. What if you have to dig a little deeper for that? What's a great way to build rapport with someone that you have to spend day to day with?
Once again, take your time. Take
Okay.
your time, slow down, and when they do talk to you, listen to them. Honestly listen to what they're saying, and start showing you care about the things they talk about. It may be the most inane subject ever to you, but to them it's important.
Okay.
Um, go home and Google what they talked about. Look up, okay, 18th century dolls. Okay, well, I need to look it up and get a little education on what they like or what they do. That's going to start that relationship off. You don't have to go out and buy the doll, but just know about it a little bit.
Yeah, and information is free. So I
Yes.
like that. I don't think we give enough credit for the fact that we spend almost more time with these people. I mean, and me of all people just realized that I just transitioned jobs and I didn't realize, I mean, like I miss the people I work with. But I got to thinking about that and I honestly spent more time minute for minute per day with these people I've worked with one of them for 5-6 years and one of them for 3 years. For the last 5 or 6 years I've spent more time with her than anyone else on this earth. I mean,
Hmm.
minute for minute. So I like your fact about investing in someone, like
Absolutely.
to think that. So I love
And
that.
they may quit and you have another one tomorrow. Well, you reinvest your time there, but don't be afraid to get invested. And if they see that you're investing in them, there's a natural reciprocity that they're going to
Mm-hmm.
invest in you.
I would agree with that. I like that. I love the invest part. And to be honest, I don't know how I missed the fact to just Google search something someone talked to me about.
Mhm.
Like that's one of those like I don't know how I missed that, but but I love the idea of if you're interested in something, it's like I said, it takes very little effort, very little time. It's free for me to go home, do a quick Google search. The next time we come back and talk, then I can be like, oh yeah, I read about something. I don't know.
Mhm.
18th century dolls seem a little creepy to me, but
Well, I just
I'm kidding.
something out of my head. I picked the most random thing you could be interested in, I guess. I restore
I'm a
Coleman lanterns if you want. Okay,
Coleman
so
Lanards. Hmm.
the old Coleman lanterns, I restore those. Most people don't even care anymore. But
How
so
fun!
yeah,
I love
that's
that.
that's the hobby.
Oh, how about if you're in that lead facilitator role? You are the lead communicator now. Like you're in charge of making sure everyone else communicates. How do you make that cycle work or make that happen?
I would start with fostering interpersonal communication. That I need you guys to be talking about these things, and foster that with, if you're in a hospital setting, of course, have a set once a month meeting where everyone sits down and start it and let them go. Let them start talking. Don't try to dictate, we're going to just talk about these points. It's let it give or have some time set aside that there's a
Okay.
free form of just let it flow. That's going to be, and you're not everyone's going to get along. If it turns into an arguing match, well, then you've got to step in. But, you know, give them a broad stroke idea and then see where they go with it.
Okay. I like that. So you talk about that if you have that arguing, like the next thing we talked about, I love the idea of like age specific communication. Age specific, what happens if I spend a lot of time with this person and like we don't have anything in common and I can't fight, you know what I mean? Like if like we talk about, like you have younger generation, older generation, and they're just kind of clashing, you know, I did it this way, you did it that way. What's a good way to handle if you have those two conflicting personalities and you're trying to devote all of this to patient care?
Now we're getting into the most difficult subject of all, of how to get two people that don't want to work together to work together.
Right.
Um, I try to get them to know them one on one separately, and
Okay.
then I will. There were some of the great philosophers in history have actually said, set aside time where you think of nothing. And I know, but let take 15 minutes that you set aside, and I wouldn't call it a meditation, but just let your brain kind of ruminate on everything. you'll get better ideas. You try to guide everything, it's not going to work. We can't control everything. So you
Okay.
have to sort of let go of the control for a little while and see
Mm,
what comes up. There's usually 99% of the time a solution. The trick is, as a leader, finding that solution.
okay.
Um, I can't give you a specific, one or the other, but getting people to communicate, you've got to, there's something there. There's always a connection there that you can start with. If they're totally not going to get along, well, then you need to try to separate them as best you can, or put them with people they do get along with,
Okay.
and that you get a communication through multiple connections, not direct communicate connection.
I like the communication through multiple connections, because sometimes as a leader, I struggle with, do you force that connection? Do you, like, I feel like when my kids were little, I used to put them in the bathroom together, and when they would fight, because I would tell them, I'm like, there's nothing that's not in this room that you two don't need. There's a toilet and water. You're both fine. You're not coming out of here until you're getting along. And so I sometimes I have a conflict with, like, do you take it to that level? Do you put them, in that bathroom timeout where they have to get along, or do you create that multiple points of dimension?
No, I would. We're all professionals, and we need to remember that.
I
Okay, I
can't
don't.
lock people in the bathroom. Fine. I
No, no, we don't need bathroom time if we're all professionals. But
I'm kidding.
remember,
I know. Yeah.
but remember why we're doing this, and you know, you have so much inner hospitals. You have a lot of more politics per se,
Mhm. Yeah.
whereas blessedly in the mobile community, you get sometimes you're your own person for weeks at a time that
Hmm.
you don't hear from anybody. You're just out there getting it done. And
Okay.
so I've been trying to get monthly conference calls to where we just all sit around and talk, and everyone knows that everyone is still out there.
Okay.
But no, forcing the connection, I don't believe that's good. You can remind them each separately that we're professionals here and we need to
Hmm.
act that way. We need to get along that way. There's no
Okay.
backstabbing. If one promotion versus another, then you need to take that into account. But the communication should at least remain on a professional level. It's never, I'm not going to talk to them.
Yeah.
I've seen
I
it
like that.
happen, but
I
you
have.
know,
Hmm. Yeah, sometimes I do struggle with that, because there is scholarly research that would prove that you should somewhat, at times you should make them, come together, and that you should do that. And I struggle with that component of it. So I like the fact about keeping everything on a professional level, remembering why we're here. How about if you run into people with different work ethics? The show up at 6 a.m. and the kind of roll in at 8 a.m. type of, how do you create those multiple dimensional, points of interest with someone with different work ethics?
I believe then there's enough work usually to go around in larger radiology departments
Okay.
that you kind of find the one that rolls in at 8. Okay, well, I'm sure there's something that they can be doing on their work ethos that you got to keep them moving.
Okay.
Now the one that shows up at 6 a.m., give them what they want, give them that mental stimulation. And the trick is, as a leader, ask your people, what do you need from me to keep it going. My
Okay.
boss is huge into personal advancement,
Okay.
not necessarily within the company, but what can we do to help you improve your career or improve your life? I
Okay.
mean, he'll call and say, "What do we need to do in the next year to improve your life?"
Wow. That's
And
amazing.
you tell him, he's like, "Well, then for you, that's what we're going to work on." And he's like, here's your goals, here's what you can do, and we're going to work towards that goal.
I think, honestly, if someone would come to me and ask me that, I'd have to think about it. Like, what can we do? Like, it would take me a little bit to come up with something, or to create that type of pathway, almost, to do that.
Mhm.
Um, okay, but I like that. I would have never. I know that it's. I often teach students. Like, I remember the first time someone came to me and asked me, "What do you think your biggest strengths are? What do you have to offer this institution?" And I was like, So I like the fact of thinking, like, down the road, how can I do this? How about standard of care? Like you're going to run into people with different perceptions and standard of care. How do you address that if you have two individuals, or even if you have two groups or different shifts that have different varying or standards of care?
We all have policies and procedures, and we need to all follow them. Exactly. Your standard of care for anyone, and this is hence the title Paycheck Techs. I believe in not just coming to work, doing the job, getting your paycheck, and going home. That's not why we do this. Okay, the hospitals have started calling them customers. An X-ray tech should still call them your patient. Okay, and they demand a different level of concern, of care. You yes, you need to leave it at the office and leave home at home and delineate the two, but they're not just people that showed up that needs. They're people that are, for whatever reason, are there. Whether it's a simple chest X-ray or a triple study MRI, PET, nuke med, PET MRI, CT, they're there for a reason, and we need to remember that 90% of them are usually scared about it.
I
If
know.
not the exam, then the results.
Mm-hmm.
And we are as radiologic technologists and the people in that department, we are the front line of healthcare of what they see. And there's everything now is imaging. Everything. We used to be just that in the dark over there in the corner, you go get a picture of your elbow. Now we're everything. Everybody relies on our images and our quality. So your standard of care needs to be, what would you want if you're on the other side of that fence and you've got that same diagnosis?
And it is really odd. I just had to be on the opposite side of the fence. I just got over pleurisy. Yeah. Who knew you could get that? It's terrible. Yeah. But and I just moved about 10 days ago. So I was used to a standard of care where everyone knew me in a hometown hospital. And all of a sudden I'm in this large based ER. No one knows me. No one cares. No one, anything. And to be on the flip side of that standard of care was really, really eye opening. So I can definitely appreciate the fact that we're trying to create a patient-centered approach. So what does a patient-centered approach look like to you? If I asked you to define that, and I did some research on it. So there's a Health Lead USA, just some basic research was provide care that is respectful, responsive to individual preferences, needs, and values, and ensuring patient values guide all clinical decisions. So that's a lot of a framework there. But if I asked you to define what does a patient-centered approach look like to you, how would you define that to me?
A patient-centered approach to me is, first, get to know your patient. Take even a minute and get to know your patient. We communicate, 80% of all of our communication is nonverbal. So learn to read your patient's body language. Learn to read how they're dressed, their demeanor, their attitude. Those are going to give you worlds of information about what they need. I believe a patient-centered approach would be an individualized approach.
Okay.
That you're going to customize your care. It's not, I did it this way for John, I'll do it this way for Jane, and then Mark will be, no. They're all different people with different lives, different aspects, and you need to try to quickly pick up on what do they need and what can I do as a technologist to make sure they get the care that they need.
Okay.
If that answers your question.
No, that does answer my question. Do you have a certain approach? I'm trying to find some amount of reproducibility in that, though. I understand an individualized approach, but I'm trying to think in my head, how would I preface myself, or what type of almost if I do have a specific approach or something you run through every time you approach a patient, you try to get to know them, is there something that you can place some type of continuity on that at all?
Attitude.
Okay.
Attitude. When I walk up, hi, I'm Jason, I'll be your technologist today. Come on along with me. Let's see about getting you done. I try not to put on airs. I try not to be ostentatious. I'm me, and that's who you got. You got stuck with me. Let's go get this done. And then the reproducibility is making sure they're comfortable,
Okay.
explaining the exam, the basics of what we've been taught to do, and policy and procedure of how we do those, introductions, the Joint Commission guidelines, you can take those and reproduce them every time. And it's the attitude with which you take that and you make sure that you're okay and you walk them through it and you have a routine of what you're going to say, how you're going to say it nicely, and oh, I don't care how mean they are. Some people you've got to kind of grin and bear it, and you're okay, and
Mm-hmm.
for whatever reason, but your explanations can be a little more cookie cutter for most people.
Okay.
Those can be standardized, and everyone has their own little way of putting things. Um, your process of getting the exam, that can be standardized, that
Okay.
you're going to do this, then this, and you fit those increments together.
Okay.
It's kind of daisy chaining everything together.
Yeah.
Is a way to reproduce it, that you have your slots and you have to get those slots filled
Yeah.
throughout each exam.
Yeah, and I didn't mean to. I mean, I love your attitude. And I'm just trying to think. Like, I'm trying to make this feasible at the same time, an individual approach. And so
Mhm.
that's really good information. That there are pieces of it. So as you're interacting with your patient, you get to pick and choose where you kind of individualize and personalize your approach with them.
Mhm.
So
Yeah.
I can see that. That makes sense to me. So how about teaching patients or talking to patients in terms of if let's say you deal with one of those patients that is super feisty, okay, the problem that I run into though is I feel that people who make more noise get more results. So
Yes.
how would you, I mean, they do, so
The
how do
squeaky wheel
you
gets the grease.
exactly, so let's say you run into one of those patients who is just kind of they're not backing down. How do you kind of take back control of that situation?
I would say, just like the others, stop a second. Don't
Okay.
don't engage.
Okay.
Try to rebuttal everything they're saying. Just stop a second, and your hand positions is also another one. If you're crossed and defensive, well, they're going to pick up on that. Um, I'm sorry, phone.
You're okay. No
uh,
worries.
they're going to get defensive about it. Whereas your body language, if you're relaxed and just standing there and smiling, they're going to see that, as long as they're not physically interacting with you or hurting you,
Right.
then standing there and smiling and just taking a few breaths while you just let them kind of go, most people
Mhm.
figure out what they're doing.
Yeah. Gotcha. So
I,
yeah.
I
Um,
understand.
yeah. Yeah.
And taking back control is just waiting a moment to let them express themselves.
Okay.
If they're going to keep on, you can actually, I've told people, stop. And you don't stop. It's your voice and how you use it is your biggest tool. Your hands, you operate everything, but your voice is and your speech is your biggest tool as an X-ray tech, because that's what you use to talk to people.
Yeah, I like that you're voicing your tool. And as a trained leader, educator, everything else, I often think about nonverbal cues, but I probably don't stop to think that around 80% of it is that large, is that big. And probably that's applicable in day-to-day life, in interpersonal
Oh yeah.
relationships or anything else. You don't think about that 80% of how you're communicating is nonverbal. That is just that is rolling in my head right now. I'm like, oh, because sometimes I get to talk with my hands because it's just who I am. And I'll become my mother, which I'm not afraid to become my mother. If I become my mother, that's great. I will have succeeded at life if I become my mother. But I find myself doing that, and you don't probably stop to think how that affects someone else or how
Mhm,
they're perceiving that.
mhm. Your body language. If you want to be a better tech, study a little bit on nonverbal cues, body language. Look it up, of how to speak to people. Do a little research on interpersonal communication,
Okay.
and look that up and learn how to be at ease even in the middle of someone blowing up at you. You, first, be sure, try to do everything you could to make sure they didn't have an excuse to get mad at you. And then if they did get mad at you, it's how you respond to it. My wife reminds me all the time, it's not what you say, it's how you say it. And that is a huge lesson, is how you say things. You know, tell them stop, okay? And you kind of make, I can fix this. Always offer a solution. Never tell them if they ask for your name and the boss's number, you're like, sure, go right ahead.
Yeah.
And a lot of times I've had, well, not patients but managers, for whatever reason, at different sites. I tell them, you really don't need to call him, because I'm going to call him right here in a minute and let him know exactly what I did. And that's huge. Always be willing to admit when you've made a mistake.
Yeah.
Take responsibility for that mistake, and then accept what happens.
Okay.
Don't ever brush it under the rug.
Yeah.
Tell the truth.
I agree. It saves everybody a lot of time and effort.
Yes.
If you do that. How about those patients where you don't want to create any type of like false confidence or false assurance, or to me that's a hard line, because I love your aspect and love your point about sometimes we forget that it's like, this is a Thursday to me, but it's like someone else is worried that they have pneumonia and they can't pay their bills and they can't feed their kids, and like it's a whole line of down. So how do you make sure that you have that empathy and you're creating that awareness without leading them down like a false sense of hope or security or any type of assumption?
I think that's a difficult line to follow.
Yeah.
And once again, it's I would say it's how you say things.
Okay.
How you approach them. You don't want to give it, but try to keep the conversation back on the immediate what you're doing.
Okay, I like
probably
it.
be the biggest thing.
Refocus why we're here, why we're doing this.
Yeah. We're just getting an X-ray. The report will come in, whatever time frame, or we're just doing the exam today. We're gonna get this. My job is to get you through this and get you the best pictures I can.
Okay.
And remind them that's what you're here for.
Like if you focus on the facts, like we're just gathering information right now, is what we're doing. And I'm doing my best job to help you gather information, so that we can, figure out what's going on. Yeah. I like that, because sometimes I have a hard time with that, or like I have no poker face. Like you could play cards with me any day of the week. Like we were playing cards, I think Monday night, and we were playing gin, and like I'm just like I have no poker face at all. So if I did, like when I did CT special procedures, like I would see like this giant tumor mass, and I'd have to like go back and lead the patient out of the room, so that would be good for me to just focus on the immediacy of what we're doing and what we're trying to get done. Because, there are times when, I know we're not trained to diagnose, but if someone has a very obvious fracture, you're going to know that this is bad, and there's a road of orthopedic surgery and everything else. So I think it's good if you can remain focused on the immediate task. I really like that advice. So
yes.
How about if your patients continue to solicit advice from you? They continue to, how often do we get the question, what do you see? What do you, how do you deal with a patient who's continually soliciting advice from you?
I've used the adage more times than I can count. This is a lot like a wedding. I'm the photographer, not the priest.
I like that. Okay. I'm also gonna steal that. I like that. Just so
go right ahead.
Okay,
this is the wedding. I'm the photographer, not the priest.
I love that. I absolutely love that. So that's amazing. How about any type of, like, a lot of times our patients are stressed. There's sometimes a way to use stress to be positive, like to help, that patient interact, to help them kind of foresee things. Do you see a way to use stress in a positive manner? Like if your patient is stressed or you're getting that from them, is there a way to use that stress to help create a better experience for them?
Well, as an MRI tech for so long, stress is normally not going to hold them still for as long as we need them. So I usually try to alleviate any and every ounce of stress I can.
Okay.
I've never really tried to use stress back, as a positive feedback loop.
Okay.
I always try to negate as much as I can of the stress. And I'd say you can do that the quickest by not letting yourself feed off of their stress.
Okay. Like kind of like how emotions are contagious type of
Oh,
thing.
absolutely.
Mm-hmm.
Absolutely. And don't let yourself get caught up in their stress, and you're probably already stressed with your day and your schedule and everything else that you're supposed to be doing, and your
Right.
QCs are coming up. Don't don't feed off of their stress, or don't I don't know the word I'm looking for. Don't put off stress that they're going to pick up on. You have to remain calm. Don't
Right.
feed their stress.
Yeah, I like that. I do agree that if you can, yeah, because I mean, your brain goes, I know my brain at least does, like it skips from one thing to the other very readily. I get charged, my boyfriend often tells me, like, do not stir that spaghetti. That's what he tells me.
I love it.
Like,
I love it.
that spaghetti. So that's kind of what that reminded me of, because you do get in this loop of one thing leads to the next, the next, the next, and all of a sudden your thoughts are a million miles away and you're not patient-centered anymore. So like kind of, yeah, that's great. I love that. How about if you deal with a patient with some type of barrier, like if they do not speak English, if they're hearing impaired, what's a good way to still create that patient-centered approach if you have some type of communication barrier present?
A smile is the best communication.
Okay. All right.
Smile. You have in place hearing impairment help. You've got translation services, or your
Mm-hmm.
facility should. Um,
Yes, probably.
but utilize those tools that your department has given you, but the entire time smile, remain calm,
Mm-hmm.
and if and usually those people have someone with them.
Okay.
But remember, don't just start talking to that person. Address
Mm-hmm.
the patient.
Yep.
When you ask them a question, ask them a question, and then smile, and then kind of eye over to the other one,
Mm-hmm.
if I'm waiting. But you utilize what you have at hand. Use all the tools at your disposal, even if that takes a few extra minutes.
Okay.
And that, once again, that's my theory: is take your time, slow down a minute, and take your time. And you're going to have those patients that, and sometimes they stack up 4 and 5 deep, that are going to take extra minutes.
Yep.
That's what you're there for, is to take your time with them, and utilize the tools at hand properly.
Yeah, that was one of the hardest things I had to learn when I started to deal with non-English speaking patients. Is I would speak to the translator and I wouldn't speak to them,
Uh-huh.
and that was one of the hardest things. And finally, I'm so grateful that someone finally took me aside and said, Mary, hey, you don't speak directly to them. No matter. I mean, they're still picking up, like you said, my nonverbal cues. The fact that
Uh-huh.
I'm interested, I'm invested in your
Uh-huh.
care. This is what I'm communicating with you. So that I love that point, because that was one of the hardest things for me to learn, is that, I was like, oh, I'm why am I not talking to my patient anymore? So I love that. I absolutely love that.
It's also one of the
Um,
hardest to remember.
it is hard to remember because so I love that technique, that you at least were aware of that and conscious of that, and that someone taught me that, because that was difficult for me to learn when I transitioned that skill. Um, how about anything else? If we're going to call this Don't Be a Paycheck Tech, what other advice or what else would you want people to know, that you want them to know, like, hey, put this into practice day to day, every day when you get up, this is what you need to be doing.
Before you walk into those doors, wherever those doors are, leave the rest of it at those doors. Take a second, take a few breaths. I remind all of my patients every time, you can get through anything if you breathe. Just keep breathing. Dory said keep swimming. I say keep breathing. Just keep breathing. Remember what you're there for. The minute it becomes a job and not something that you're emotionally and invested in, mentally invested in, you need to probably look at something else. Okay. Even if you've invested 30 years, if you're suddenly at that point, you need to reevaluate it and go, okay, or talk to your manager and say, look, don't be afraid to express that I'm having trouble with this. This is not working, or what aspects are and are not working. If you're unhappy at one location, but you still like doing what you do, time to find another location. Uh, be willing to change. Um, change requires motion, and motion requires friction, always. So just remember that, if you
I
get
want to hear that one more time. So
change requires
price,
motion,
motion
motion
requires.
requires friction. From a
I like
physics standpoint,
that.
it's always going to take friction.
I love that. Yeah. So, we'll just kind of wrap up with a couple of, like I said, like, just so the audience gets to knows you. And I like getting to know people too. And I love your passion, and I love your drive, and I love your attitude. And I probably, that's the type of thing that people need to be hearing, and that they need to be feeling and bringing to work with them every day. So I already kind of asked a couple of wrap up questions. What are you most grateful for in your life?
I'm so blessed in my life that I have probably too many things to be grateful for. Wonderful wife, wonderful children. I live where I want to live. I get to do what I love to do. Um, I'm grateful for my boss. Thank you, Lynn. Just one, I love my job because 2 weeks ago we were taking apart a magnet and craning a new one into a trailer, and then I got to go meet people up in another site, and this next week I get to teach people how to use their MRI, and then a week later I get to go do patients out in West Texas, and so I have a great job that has multifaceted. And that's what I would tell Texas: don't be afraid to learn how the things work. When an engineer comes to fix it, if you've got 10 minutes, watch how they fix it. I learned how to fix MRIs by doing that. But be willing to learn not just the CEUs that we have to take all the time, but learn what you want to learn. And there's so many different aspects of the radiologic sciences that be willing to learn, branch out, investigate. You might find something else you totally love, and it just comes so easy it's not even funny.
Good. I love that advice. I was going to kind of ask, like, what advice you have for a younger generation, and don't be afraid to branch out. Don't be afraid to, because I'm places in my career, in my life right now, that if you would have told me I would have been here, I would have laughed you off the face of the earth.
Absolutely.
I absolutely would have. I would have been like, no.
Younger generation, I would say, learn from the people who have done it for so long. Okay, they kind of know what they're doing, even though you may not agree with all the other aspects in the world about them. When it comes to radiology, they probably know what they're doing, and learn from that. Don't bring all your other stuff from outside into your workplace. I don't like how we're doing that. Okay, we're there for our patients, and we have I guess the old movie, we had a unique set of skills that we should use to our best advantage, and honing those skills, and be the old guard, be willing to change as our technology adapts. All the aphorism I love is, if you keep doing what you've always done, you're going to keep getting what you've always got.
Okay.
So be willing to change, but at the same time, keep that knowledge. We're losing so much knowledge in how to treat patients because we're worried about technology. Learn from those. Watch those techs that have always that their patients give them great satisfaction surveys. Those are the people you want to emulate. You want to learn from them.
That's great. I love that. And then you have to share your other saying before we go, though. The Latin saying about if you understand this, you know too much. You have to throw that in there, because I love it.
It's actually written, but si hoc legresis ningunum eruditoides habes.
And that means if you understand this, you have too much.
You're
education.
overeducated.
Well, I didn't understand that, so now but I love that.
I learned it years ago. I thought it was hilarious at the time, and it's always stuck with me.
I love that. I absolutely love that. Well, I want to thank you for taking your time with us today. Thank you for creating that input and that attitude for people when you go to work every day, that this is more than a paycheck, because that really people appreciate that, and it flows down the line. And so thank you so much for talking with us today. And I really appreciate your insight and your opinion. It was absolutely fabulous.
Well, thank you very much for having me. I really enjoyed it.
Good, thank you.